But what struck me is when she said there were so many that wanted to participate that were people of color that they didn't know where to look. And I'm like, that's unacceptable. First, the doctors should be very cognizant of what's going on because clinicians have more at their fingertips than the patients do. But at that, there's a growing database across so many institutions that, like, I'm wondering from where I'm sitting, how can we as patient advocates not only lend our voice to the protocols that are being written, like all those answering all those questions that she had up on the screen, but how can we kind of get the word out on the street that, hey, here's 8 different websites for you to go to that each one will give you at least 20 different clinical trials. For me, knowledge is power. And you've kind of taken the power away from these patients when you haven't given them the knowledge. But it's not like the knowledge is hidden. It's just not been well advertised or put in a central place. Okay, let's decentralize the trials so it makes it easier for patients to be a part of it. But then let's centralize the resources so that they know exactly where to look to get the information.
Kimberly, everything that you just said, that's honestly that is the problem, bringing that information and to the public eye, because this is a revolution, and cancer is a universal language. And the ones that we have been screaming that, our community, we have a 40% higher death rate. We have so many disparities, that we carry and that are just included in our day-to-day journeys. How come they're not commercializing this information? Because one of the things about our community is we don't like to read.
Yep.
We like instant gratification.
Yep.
There's so much to those two statements. And another thing, we like to eat food. Okay, so why aren't we using those platforms? Why isn't there any information in those realms? Why aren't they everywhere? We should be putting that information in those communities. And so in regards to like my platform as a patient advocate, I try my best to just keep giving out that information.